Good afternoon, everyone. It's a real pleasure to be here to talk about the obesity prevention program at Bloomberg Philanthropies, which I direct. And I just want to thank the organizing committee and Bill for including me today. So I'm going to give you an overview, a really quick overview of our investment in obesity prevention, provide some rationale for why we're approaching it the way we are, and then talk a little bit about some of the specific activities that we are supporting. I love the comment someone made earlier, I think it was you, Olivia, about there being a transfer of lessons from developing countries to developed, and I hope to show you that that is very much the case. So we essentially partner with the best advocacy and research organizations we can find to raise awareness of obesity and to identify, implement, and most importantly, perhaps evaluate effective obesity prevention policies in low and middle income countries. Listed here are our 6 priority countries. They are Barbados, Brazil, Colombia, Jamaica, Mexico, and South Africa. We started initially only in Mexico back in 2012 as a pilot program, and that was quite successful. And so in 2016, we expanded to these other 5 countries. We also have what we call an evaluation fund. So we recognize that promising policies will hopefully be adopted all over the world outside of our focus countries, but often there aren't resources to evaluate them. So we felt really strongly that we've got to have some resources available for rigorous evaluation. And at the moment, that work is occurring in Chile and some US cities around the sugary beverage tax. This is an overview of how we are approaching the issue. We recognize that this is a complex issue. There are many upstream factors, downstream factors. We, I think, are kind of working in the middle. We are working on demand reduction policies. And the 4 policies that we've prioritized are listed in the middle here. They are fiscal measures, marketing restrictions, front of package warning labels, and healthier public sector, particularly schools. And this list of priorities was developed in consultation with the world's leading scholars, I would say, who talk to us about the best available evidence. And we do revisit this regularly, and you know, the list has pretty much stayed the same over the last 6 years. I perhaps should have mentioned, or I'll mention now, our largest investment at Bloomberg Philanthropies is tobacco control. And probably you've heard there are many parallels between tobacco and obesity prevention. We are certainly applying the lessons that we've learned from tobacco control in the obesity prevention space. It's not a perfect parallel, but there are important similarities. And interestingly, we are also observing that many of the tactics that the food and beverage industry employs are the same ones that the tobacco industry has employed. So how do we support this kind of policy change? We, as I mentioned, we support civil society groups and researchers to do advocacy, mass media, and research, and hopefully when they're working together, because this is really not something any one organization can do alone, you'll have policy change, and then once the policy is implemented, we support evaluation. And the best, I think, the best example of that is Mexico, and we heard about how civil society and academia partnered there to bring about a sugary beverage tax, and we've been supporting evaluation of that. And ultimately, our goal is to improve the food environment so that healthier options are the default. I want to pause for just a moment to talk about why we are taking a regulatory approach. I'm going to say right now that these are not perfect comparisons. That data just doesn't exist. And my point is really to show you what we view as very different rates of progress when you've got a voluntary measure versus a regulatory one. So recently, the American Beverage Association has a 2025 beverage calorie initiative with the goal of reducing by 20% or 40 calories the amount of beverage calories per person per day. And recently they commissioned Keybridge, who released the results as of the end of 2017. And we see that there was about a 2.8 calorie reduction in about 3 years, that's about 1.4%. I want to contrast that with Chile. Again, these are not perfect comparisons, but I think the point holds. We've heard quite a bit about Chile's front of package warning label, which if you exceed a certain threshold of sugar, salt, calories, or saturated fat, you must have a warning label, and then that product, if it carries a warning label, cannot be marketed. And so we'll look at Fanta. In 2015, you can see original Fanta here, 51 calories per 100 mils. Then in June 2016, the warning label regulation took effect. And by 2017, we had new and improved Fanta, which had 20 calories, so that's a 60% reduction in a relatively short amount of time. And they also introduced Fanta Zero. I think one of the things I ask myself is, okay, if they've done this to Fanta in Chile, why can't we do this everywhere? Some maybe points for discussion. Another example comes from the UK. So the UK has both a voluntary measure in place and a regulatory one, and Public Health England recently evaluated this. So probably most people in this room know that the UK has a sugary drinks levy that came into effect in 2017. It's based on the amount of sugar. And the tax was announced in 2017. And so in 2 years, we saw massive reformulation in order to reduce, the industry wanted to reduce the tax burden on their products. So we saw the sales weighted average sugar levels per 100 mils fall by about 11%. That also equals about 6% reduction in calories in a single occasion. And so contrast that with what we saw with the ABA, where we saw 1.4% reduction in 3 years versus 6% in 2. The UK also has a voluntary measure where the government challenged industry to achieve a 5% reduction in the first year of a multi-year challenge of sugar in a number of categories of food and beverage products that most contribute to children's intake of sugar. And at the end of the first year, they documented only a 2% reduction. Compared to a goal of 5. So now I'm going to switch and talk a little bit about how we support advocates and researchers in the countries where we work to bring about policy change. So the basis of everything we do is solid evidence. We look at this from a public health lens. And so often when we start working in a country, the very first thing we do is start pulling the evidence, understanding it. So here are some examples. In Brazil, for example, the advocates there are working on a front of package warning label regulation, and that's been submitted to the regulatory agency. In order to make that case, we supported an RCT which looked at different labeling designs. Lots of work around modeling the impact of sugary beverage taxes in South Africa and Colombia. In Mexico, they have a tax, but a group of researchers including Simon, modeled the impact not only of the current level of tax, but also of doubling the tax to make that case for increases. So that's step number one. A very big proportion of our funding goes towards mass media or raising public awareness. And we we don't have all the resources in the world, so we're quite strategic about how we use these dollars, and usually these campaigns are coupled with a policy campaign. So this is a campaign from Mexico that was aired just in advance of the sugary beverage tax campaign. For those that don't speak Spanish, it says, would you give them 12 teaspoons of sugar? Well, then why do you give them soda? And this, I think, and Simone, I think you can speak much better to this, but I think this was very eye-opening at the time. I think in the US, we had become somewhat sensitized to this, but in Mexico, it was a new message, and it really had major impact. And all of our campaigns are very evidence-based. So we do lots of pre-testing, message testing, then it's on the air, then we do post-campaign evaluation. And drawing from the tobacco control experience, we tend to go for hard-hitting graphic campaigns. I'm gonna show you an example from South Africa, which also ran, this campaign ran in the lead up to their adoption of their sugary beverage tax. Which was just earlier this year, in fact. So this campaign is called Are You Drinking Yourself Sick?
People drink themselves sick with sugary drinks. Sugar is dumped into the bloodstream with every sip.
Can you hear it? I don't know if it's possible to do.
Organs, bringing on obesity, heart disease, and type 2 diabetes.
So maybe I'll just start it again, just to be sure.
People drink themselves sick with sugary drinks. Sugar is dumped into the bloodstream with every sip, leading to fat buildup in and around vital organs, bringing on obesity, heart disease, and type 2 diabetes. And the earlier in life somebody gets diabetes, the greater the risk of complications later. Are you drinking yourself sick?
So this was a campaign that has been adapted in a number of countries around the world. It ran in New York. There was a version. It's run in Los Angeles, Mexico, we've found, so we do pre and post testing of these campaigns, and we find that they have a lot of impact in people's understanding of the causes and consequences, and also in people's expectations of what their governments should be doing to protect them. So we work in Jamaica and have run a number of campaigns there, and a recent post-campaign evaluation found that 9 in 10 Jamaicans expect their government to act to protect them from the products that are causing overweight and obesity, and 81% support a sugary beverage tax. So we feel it's really important to bring the public with you, and often when policymakers know the public's on side, they're more willing to take those risks. So a little bit more about public awareness. We also do a lot of, not we, but our partners support a lot of grassroots activity. These are actions. The top left there is in South Africa, at the bottom is in Colombia, on the right is in Mexico. These are often in front of relevant government agencies. I'll explain the one on the right with Mexico in case you're wondering. So Day of the Dead is a very important moment in Mexico, and this was early on in 2012, or it might have been 2013, in the lead up to the sugary beverage tax being passed in Mexico. Our partners there, El Poder del Consumidor, basically commemorated the 500,000 people that had died from diabetes over the previous administration. This was when a new administration had just come in, so they were putting a spotlight into the 500,000 deaths from diabetes. And this just went viral. It got so much media attention, and our partners are very skilled at keeping this issue in the news and creating that sense of urgency. And I think that is really what creates or softens the ground for policy action. I'm going to speed up a little bit. Another major emphasis for us is coalition building. These are, we've got 3 very active coalitions. one each in South Africa, Brazil, and Mexico. These are broad-based. For example, the coalition in Mexico has Greenpeace and Oxfam and farmers groups and waters rights groups. And it's not easy. I don't want to at all make it sound that it's simple, but you know, the partners have done just a beautiful job of finding common ground. And so you have this group of 20, 30, 40 really credible organizations advocating for the same thing. And then once we hopefully have policy passage, we support evaluation, post-implementation, and that we've done the most of that in Mexico, and you can see a number of papers here from Mexico. There's also one here from Berkeley that we've supported, and all of these papers show that sugary beverage taxes are working, and by working, I mean they are reducing consumption of harmful products. I don't mean they're working to reduce overweight and obesity or heart disease. That's going to take a long time. But we are seeing those positive dietary shifts, and we know enough about the causal pathway to obesity and diabetes to be quite confident that these shifts are going to have an impact. And in fact, since Mexico passed their tax and adopted it in 2014, we've seen a number of countries around the world adopt taxes. We are optimistic that this is soon going to become public health norm. And really big countries, India has included a tax in their GST reform, South Africa, as I mentioned, the UK, and you know, we are optimistic more are going to follow. So where are we heading with all of this? As I said, ultimately, we're interested in understanding what works. We're still in the early days of this epidemic, and you know, you may hear people say obesity prevention is where tobacco control was 30 or 40 years ago. We believe we don't have 30 or 40 years to understand what works, and so we're really trying to accelerate the generation of that evidence base. So what we would like to see sometime in the relatively near future are diverse policies implemented in our focus countries, evaluation of the early impact of these policies in both our focus and non-focus countries, and the beginnings of a policy package that any country can begin to adopt. So thank you so much for listening, and look forward to the discussion.